Welcome to the second video of the clinical saga Sensory Psychology Address. In this occasion, we will learn about sensory psychology and its way to intervene on autonomic aspects of the client. I believe that there's no better way to start than sharing with you my first American clinical practice. This experience led me to the importance of sensory stimulation as an effective intervention for solving mental issues. It was at Devereux Cancer Center, located in Pennsylvania, honoring Dr. Leo Kanner, an Austrian psychiatrist who developed the term of autism. Immigrated to the States by 1924. This center is a campus of children and adolescents suffering from mental retardation. More than half of the population was autistic meanwhile I worked there. I had the opportunity to observe hundreds of autistic behaviors of any kind, all related to sensory episodes. In fact, the definition of autism is sensory integration issues. This experience counseled me to the following conclusion. If sensory integration issues causes bodily functioning, emotional, social, behavioral, and thinking or cognitive inconveniences, what if non-autistic people suffer for a similar reason? Of course, autistic population has nervous system and brain damage, but non-autistic disorders could be a result of wrong sensory stimulation. This particular topic will be explained on the next video, Sensory Eating Disorders. Back to sensory psychology, it includes two mental health perspectives, neuroscience and traditional Chinese medicine. There's no need to integrate these two practices. Just by stimulating the senses while providing a cognitive direction is enough to consider it as a sensory psychology intervention. As I said before, sensory psychology accesses the autonomic aspects of the client. By applying them, three huge advantages can be obtained. More effectiveness and speed, due to avoiding to confront with consciousness. Less psychic pain, due to desensitizing through anesthetic means or through rising pain tolerance by empowering. Greater scope of action, due to avoiding the limitations of suggestible, analyzable, or programmable procedures caused by clients' resistance. Based on these advantages, while developing multi-level tone calibration, symptom and trauma management, I included 4 clinical strategies to allow maximum effectiveness and speed. Multi-level action. Simultaneous stimulation of the somatic, cognitive and emotional areas. EMDR, eye movement desensitization and reprocessing, and MTC-STM, multi-level tone calibration, symptom and trauma management, utilize this kind of approach. MTC-STM is the one that focuses on the autonomic aspect, allowing more global results with less resistance. This practice produces such a remarkable impact on the social area that is included as part of the treatment. MTC-STM also includes resources to enhance the outcome of practices based on collective awareness, such as yoga, meditation, contemplation, and so forth. Action over autonomic. Many schools use consciousness as a negotiator with the unconscious, the autonomic. Sensory psychology avoids the conflict that involves crossing consciousness to its most unconscious instance. NTC-STM relies on sensory and cognitive stimulation to impact directly on the autonomic portion. This shortcut produces clinical amazement phenomena due to the absence of consciousness mediation. The experience is unable to be rationalized. After the intervention, the client is just better and surprised. Global action. Many schools address sign by sign, disorder by disorder, as the strategy to reach the cure. MTC-STM focuses on solving all the issues as an integrated whole, leaving the remaining conflicts of the global intervention to the final stage. This strategy pursues the biggest relief from the very beginning in order to make the rest of the process less painful, more simple, and more effective. Action over achievements. The development of insight is as important as the healing process itself. To do this, many schools use the material arising from the resolution of conflicts. MTC-STM, for obtaining positive results since the beginning, does it through the material that arises from the comparison between recently earned achievements with the difficulties that so far were operating. In this way, the affective charge of the insight occurs in a state of relief instead of a suffering one. This strategy enables the optimal registration of the insight. I would like to finish this video by sharing with you another personal experience. Besides discussing my development with other colleagues, I consulted my father very frequently. He is an engineer and was professor of chemistry at the most prestigious University of Buenos Aires, UBA. Of course, I was looking for a scientific mind to criticize my statements in order to be the most precise as possible with my expressions. I needed someone out of the psychology field to get a neutral opinion. This has been a great support for challenging me. The problem came when I used to tell him what my clients' feelings were when practicing MTC-STM. One of their most frequent expressions has been, "This is magic." My father hated each time I told him so for not considering a serious statement. And my usual answer was always the same. "I know that it is not magic, but they feel so." One day, he went through a lumbago or lower back pain. So I suggested him to gently stimulate the painful area. And he did so. But when he wanted to stand up, he was very weak and he couldn't make it. So I looked on him and said, "Okay, Dad, you relaxed the area for vanishing the pain. Now you need to strengthen up. Just do the MTC-STM exercise." And he did so. He stood up without any inconvenience. The whole process took less than 2 minutes. And astonished, he said, "Oh, this is like magic." And I laughed out loud, reminding him the many times he was against a statement like this. Now you see that it is not magic, but it feels like it is.